Thank you very much. Our next speaker is Hanifa Denny. Dr. Hanifa Denny is Associate Professor and Director of the Undergraduate Study Program of Public Health with the Department of Occupational Health and Safety at Diponegoro University in Indonesia.
Good afternoon for American audience, but selamat pagi bagi audience di Indonesia. Magandang umaga bagi Filipino and sabahul khair bagi Arabic for Arabic audience. I would like to address the effectiveness of occupational health intervention for informal sectors in Indonesia, but before I proceed with my presentation, I would like to express my gratitude and thanks for Dr. Ivan Ivanov, who introduced me to this wonderful group of think tank. So thank you very much again, and thank you for inviting me. Actually, my presentation would be based on my work as a consultant for the Ministry of Health, as well as researcher in occupational safety and health, also doing with my work on the community engagement with the informal sector workers. I was inspired by this informal sector workers and occupational health. I recall that when I was kid, my late father got a dermatitis contact, and we took them to many dermatologists, but he didn't get cured until his last day in the world, until he passed away. So then, when my family suggested me to go to the medical school, but I realized when I went to the medical school, there is something that I have another passion. So I asked some of professor, what is the profession that I could engage with the real community, and I have a lot of travels. So then the answer is public health. So I switched to public health. And then I asked again, what is the field of science that could resolve my late father problem? The answer is occupational health. So that since 1987, my passion grew, that I really have to master occupational health sciences without necessary I stay in the hospital, but I really want to travel to the whole world. That is the start. So in this presentation, as requested by the organizer, that I will talk about the public-private partnership engagement pertaining to occupational health services for workers in informal sectors, some notable activities to reach out to and engage the informal sector through policy, financing, and or service delivery. And then the involvement of other sectors in occupational health, sustainability issues in financing, technical assistance, service delivery, and relationship or partnership. And then the key for success, barriers, limitations, and strengths. The overview, when you look at Indonesia, you have to have the imagination that we are just like a fish. We live in a 17,000 islands, and we have more water than the mainland. And we have 237 more million population with the density of 323.05 per square mile. So it's not like huge when we live in the US. So I'm very comfortable to be in the US and so grateful to be here for 4 years. And then when we talk about occupational health for informal sectors, we have to familiar our ears with post UKK. We don't talk post UKK, but we have to say post UKK. Means it's occupational health post at the village level that are the units to promote occupational health as part of the initiative to empower communities through participation. And then what is the um, feasibility to establish a post UKK? There is always a need. If there is a need, there is a willingness to adopt and volunteerism from workers, including workers in informal sectors, home industries, and small-scale enterprises with similarity in production. Then there you go. The government will assist to set up a post UKK. Here is our occupational health care network systems in Indonesia. That the post UKK is actually the community participation and voluntary based activities that is set up based on the similarity of production. And the activities of post UKK are assisted by the community health centers. There is also polyclinic of the companies or factories, but they are not necessarily contribute to the occupational health for informal sectors. When we talk about community health center in Indonesia, we have to be familiar with Puskesmas or Pusat Kesehatan Masyarakat as a unit of inpatient and or outpatient services that serve an average of 30,000 population. Now in Indonesia, we have almost 10,000 operational puskesmas. So the existing structure of our health services is actually, we can say that is notable and very highly structured and well structured. And also we focus on community-based participation. And how about the BKKM? It should be BKKM, but it's BKKM as a center for occupational health services. It is a referral system of occupational health services, but it was only the pilot project that we only have 4 operational units in West Java province and 1 unit in Makassar, South Sulawesi province. I would like to address some public-private and NGOs partnership engagement. For example, that Puskesmas Cendrawasih in Papua or Irian Jaya, along with other community health centers, received support from Kinerja US State for occupational health service outreach. And then BKKM Bogor, West Java, received support from the ILO in 2006 to improve the working conditions of the footwear home industries. Imagine that the footwear industry, they produce the footwears at home and they involves working, the involvement working, their work with the solvents is unbearably, it's really, really bad. Even the smell and also the indoor pollution, we cannot imagine. When I visited that kind of home industry, it is very sharp smell. So this, we don't talk about how is the toxicity because we haven't gone into the health surveillance. And then community participation, the embroidery home industry's owners, workers, and village officer requested to and assisted by Puskesmas. This is an example in Bangil. The community that have embroideries home industry. They form a post UKK, and they fascinatingly they found their own solution that we just guided. Okay, we try to they work they put the stitch on a fire, and then they make it a hole before they make an embroidery. But it was funny because they use their lap. So we try to ask them whether it is painful or not. And then, why don't you use the table? So we discuss to make a solution, and yet it's successful. Okay. It is just sometimes a simple idea that they never think about, and we just come as a person who just try to make them to recall and aware. It is very simple solution. And then some major companies operating in West Java provinces supported the occupational health post activities through the um, provision of facilities of the rooms and simple equipments like first aid and etc. And then the Ministry of Fisheries and Maritimes contributes to the health program for traditional fishermen and traditional divers. We had many cases on traditional divers because they don't know about Boilo, they don't know about Archimedes. So when they dive, they really don't pay attention on the hyperbaric risk. And very sad that we realized that the community health center's physician, they don't have any idea how to treat the hyperbaric cases. So they thought it was a neurological disorder, then late treatment, so they get paralysis. No productivity anymore at all. It's just a delay in a proper treatment. So this is a big problem. And then now we are trying to work together with the Ministry of Fisheries and Maritimes as well as the Navy to train them how to dive safely. So divers here is not for pleasure, but they hunt the fish or sometimes the debris from the shrinking from the wreck ship or some other purposes like pearl hunting. This is, we call it the one that we mean about the traditional divers. So there is no personal protective equipments because the diving's personal protective equipment is so expensive. So they just dive it, and it's very amazing to see their skill, but they really don't know the uh, hazard that accompany their habit. How about our policy? Actually, we have an excellent policy and regulation, but the problem is how do we really make those policy to really enforce properly? So law enforcement is also some kind of issues. The occupational health post is also stated in our policy that occupational health post is one of the basic occupational health service units located in the workplace area and managed by the workers as volunteers. And then also it is a good news that occupational health services covers workers in the formal and informal sectors by law number 36 in 2009, because formerly we only had one law. It was 1970, that is the safety law, never occupational health law. So this is a good progress in terms of policy in Indonesia. Also, the Center for Occupational Health scope within Ministry of Health Republic Indonesia was expanded under the new Directorate of Occupational Health. So previously, we didn't have a Directorate of Occupational Health within the Ministry of Health. So actually, I'm happy that I was the one who helped them to set up what is the job description and etc. And then because we have a rule that all state employees must be regulated under the Ministry of State Employees Empowerment and Bureaucratic Reforms. So they enacted the position of occupational health regarding the function and mission. And then the Republic Indonesian presidential instruction also have stated a policy concerning the health protection of fishermen. There is also a good news that the annual budget for occupational health program increased threefold from 1.5 million US dollar to 5 million US dollar currently. And then 50% of the budget was utilized to deliver occupational health services for informal sectors. And then beside the spending by the central government, the discretionary funding also was made available to the provincial health offices. And then there is also a good progress that local governments start to aware to contribute more on occupational health allocation, although that funding is are generally patchy and mostly engaged in the pilot project level. Service delivery of occupational health for informal sector in Indonesia. What stated as a pilot projects for the establishment of occupational health posts or PORS UKK in 2002 and 2006 has to date resulted in more than 5,000 operational post UKK. And then the pilot project focused on the establishment of Center for Occupational Health Service in 2002 has resulted in 5 operational of PKKMs. And then occupational health risk mapping has been done by the Directorate of Occupational Health together with some provincial health offices at selected provinces and workplaces, including informal sectors. What I'm doing now, I'm involving in the occupational health mapping and some local governments for the small-scale home industries and informal sectors. And that training for the volunteers of post-UKK, and then occupational health training for puskesmas or community health center personnel that has covered 3,000 puskesmas in Indonesia. The distinctive of the success on this project if the participants of the training consisted multiple educational background and multiple job description within the community health service, then they will likely to work on to execute what they got from the training. But if the only medical doctor or physician, they would say, I'm busy to cure the patient. How can I create a new program that is not really stated as the minimum standard of service in the community health center? So it is just an additional burden, but my main duty is to cure the patient. So there is some kind of issue that maybe it's different in some countries. And training and technical assistance on occupational health for traditional divers, fishermen at Rio Island, Maluku, Seribu Island, Cilacap, Semarang, and Situbondo. And this year, we are targeting to train all of the traditional fishermen and divers based on the location that have been listed by the Ministry of Fisheries. So it is likely covers the whole provinces in Indonesia. It's a huge project under the budget directly from the President of Republic of Indonesia. The diagnosis of occupational diseases training was delivered and recruited general physician participants who work at Puskesmas in Indonesia. There is a sadness case that one physician gave a TB medicine, and then we met, and then he told me like, why this TB cannot be cured? And I just asked informally, have you reviewed his work? And then we found out he is the stone breaker. Okay, so this is the example of how the misdiagnosis will affect the curative. And then the Directorate of Occupational Health and Sport, now it's, before it was a Directorate of Occupational Health only, and now it's the government adds the sport. It's leading sector of occupational health service delivery for informal sectors workers. The Ministry of Manpower and Transmigration involved in selected project, but their focus is on a big scale companies. And then the Ministry of Agriculture has partnered also with the Ministry of Health, the Ministry of Industry as well. And then financing is a main issue in delivering occupational health. If Puskesmas doesn't contribute, doesn't continue to its supervisory, informal sectors have difficulties in sustaining their promotion. And then the partnership with the local big scale company has not been promoted widely. And occupational health program is not included in the national minimum standard of service of community health centers. The success is the supervisory and assistant, and then also the Puskesmas assistant, and then the outreach program. Occupational health promotion through Puskesmas and post UKK is the one that we can rely to really expand their service to occupational health service for informal sectors. And then there is a notable effort credited to make home industry owner believe that they and their workers work better because they felt better about their health after joining occupational health post. Thank you very much. I think I take a lot of time. Thank you.